Hello, good afternoon. How are you? Today is January 22nd, 2026. I've been assigned to do IV piggyback evaluation on a patient named Mr. Shepherd, a 72-year-old man, admitted to my Mason unit with history of pneumonia. Currently, he's receiving IV D5 half normal saline at the rate of 50 milliliter per hour. My physician has ordered ceftriaxone sodium 1 gram in 100 milliliter IV daily to be administered over 30 minutes. The drop factor in the tubing is 10 drop per mil. That means I'm going to be delivering 33 drop per minute. This is going to divide the volume, which is 100, by 30, the time, multiply by 10, you will get 33 drop per minute. So I'll go ahead and gather all my supply now here. Then I'm going to use for this, I'm going to check the drug compatibility, the D5 half normal saline and the ceftriaxone sodium. They are compatible, so they can infuse together. So I will go ahead and introduce myself to the patient. My name is Julie Ebube, a nursing student of Allegheny College of Maryland. I'll go ahead and provide you some privacy. For hand hygiene. I'm going to go ahead and identify my patient using two identifiers. Check your waistband. Okay. What's your name and your birthday, sir? Okay, Mrs. Shepherd. Okay, let me look at the waistband again. Okay. Your little bird, everything. Yes, haven't done that. Are you allergic to ceftriaxone sodium? Okay, you're not allergic to it. Let me quickly give you some little education about this antibiotic and then what I'm about to do. You have pneumonia, and that is why doctor has prescribed antibiotic. So pneumonia is infection of the lungs, which means your alveoli has been inflamed and has some fluid in your lungs. That's why you're having difficulty breathing and all the complications and symptoms. So I will encourage you to cooperate with me. Just be adherent to this medication regimen. We got to be on it on time. If doctor said it has to be administered at 4 p.m., every day it has to be 4 p.m. So that way, when we are consistent and you are compliant with the medication regimen, that way you feel okay and then you feel better. So there will not be any relapse and any resistance. So we're trying to make sure that the pneumonia won't come back again. Okay? So I'm going to make sure that I check the doctor's prescription, that you are the right patient, which I've already confirmed, and I give you the medication at the right time, the right dose, the right medication, the right route, and at the right time. So that's what I'm going to ensure. That's the only way we're going to make this work out, and then you feel better very soon. Okay? So now, perform hand hygiene again. Put on my gloves. Let me check your IV site. Make sure that no infiltration, no inflammation, and there is no redness, no edema. Everything looks perfectly okay. So we are good to go. So now I am going to open the package here for the IV infusion. Let me grab my the secondary IV line. And then first of all, let me go ahead and put this over here. Okay. So, and then this is the secondary IV line. The tubing, the medication to be administered here is here. So I'm going to go ahead and take this cap off, and then also take the cap over here from the spike. So I'm going to go ahead and put a spike right here. Okay. And then hang it over here. Make sure it's higher than the primary IV line. So I'm going to go ahead, press on the center tubing here to bring out some of the medication, and I'm going to go ahead and prime it. So I'm priming it right now to remove air bubble, which I have done. I'll go ahead and climb it. So climb the IV line. So applying aseptic technique, I'm going to clean the Y knot, connect into the main IV line, and allow to air dry. And then to air dry, and I'll go ahead and connect this secondary IV line tubing to the Y knot here, to the main IV line tubing. So having done that, I'm getting set, and I'm going to label the tubing, putting name of the medication, the date, time, and initial. So now I've connected this. The primary IV line is running, then the secondary one is also running. So I'm gonna go ahead and I'm going to go ahead and set the pump. So I'm going to set the pump at to run at 33 drops per minute for over 30 minutes. So I've set the pump now, and here it's running. The primary and then the secondary line are running. I'm going to hang around here to ensure that there's no allergic reaction, that my patient is doing well. Make sure you're tolerating the IV, that everything is going very well as planned. So I'm going to connect everything here, ensure that everything is well connected and infusing well. So I am looking at you, Mr. Shepherd. No allergic reaction, no swelling at the site of the infusion. You are tolerating the infusion well. Okay. So let me just step aside and get something from the nursing station. I'll be right back. Okay. Hello, I am back. And it looks like everything has been infused completely. Wow. Well done. So, let me check again. Oh, it's not swollen. Everything, no allergic reaction. You're doing very well, Mr. Shepherd. So proud of you. So I'll go ahead and discard all that needs to be discarded. With the primary IV lines, IV lines still running, I'll go ahead and discard whatever needs to be discarded, and I will perform hand hygiene, and then go ahead and document everything that we did today. The volume, the amount infused, everything, and the way you responded, and then there was no allergic reaction. You tolerated the medication administration very well. I am so very proud of you. So you are safe, no reaction. So I make sure that I apply the facility safety protocol. Okay, thank you so much. If you need any help, here is a call light. I'm going to just hang it around here. Call me, okay? And I'll come around to help. Thank you so much. Thank you.